So without further ado, I would like to go ahead and introduce our final speaker of the day. She's going to bring it all home with a very important topic on the importance of investing in early childhood development. I'd like to welcome Allison Baulos, I hope I'm saying that correctly, to the stage. Allison is the Executive Director of the Center for Economics and Human Development at the University of Chicago. She works with economist Professor James Heckman and others on large-scale research initiatives on human capital development and promoting opportunity for under-resourced children and families. Allison holds a BA in psychology, an MA in social work, and an MBA from the University of Chicago. Sounds like you're a perfect fit for our Congress. So welcome, Allison, and thank you for being here. Over to you.
Yes, thank you so much. Can you hear me and see?
Yes, perfect. Yeah. And I see your slides as well.
But let's see. Okay, yeah, okay, great. So yes. I am really honored to be here on ISTCAN's virtual stage and cap off, okay, sorry, I'm getting notifications to let people in. I think I can ignore that. Yes, to cap off your World Summit. So virtual, it's new for me. So we've all learned so much the past 2 days. I mean, I'm just so inspired by to be part of this wonderful cohort of distinguished individuals and organizations. Everyone's really committed to the prevention of child abuse and neglect. And so I'm joining you from the very cold city of Chicago, and I co-lead the Center for the Economics of Human Development, as you said, and we're led by Nobel Prize winning economist, Professor James Heckman. But really our research center is fortunate to have a global network of partners and collaborators. I'll highlight some of the work for you and the innovative research that our group is doing in partner with with these other groups. So I want to build on what other speakers have discussed and present some evidence about the economic impact and show you that not only are you helping children and families, but you really are making your countries and economies stronger. So an abundance of rigorous research has demonstrated that public and private investments in programs that serve children and families have an exponential return on investment. Those gains are both through individuals as well as through to society. And many of you know this graph. It's motivated by an array of empirical evidence from studies of human capital investments. And this is called the technology of skill formation. And it represents the return to a unit dollar invested at different ages of the life cycle. This is not to say we should only invest early, of course. Investments into adolescence and teenage years and adulthood do matter, but they're more effective when they're building off of a solid base. So to put it simply, skills beget skills. And promoting early childhood development is the foundation on which we build human and social capital. It's the first and most important investment that's necessary for all later investments and programs the governments and philanthropists would be investing in, especially for when children are most at risk for abuse and neglect. As such, it should be the first policy priority. And accordingly, neglect and abuse do stunt growth. So there's a great deal of opportunity that is lost when it's not prevented early. So many policies invest in one particular program or target one particular area, such as food insecurity, literacy, early learning, mental health. All of these are important, but what's missing is the unification that makes these interventions an effective tool to promote opportunity and, like I said, to prevent abuse and neglect. And to counter those negative effects of those risks. And really what it is, it's about building a skill base. So policies should not just be looking at one specific metric or boosting cognitive skills. You really have to think about the skill base as a whole of what you're building, which would be health, cognitive skills, non-cognitive skills, and family resources. So one of the first programs I'll talk about is out of the University of West Indies in partnership with Sally Grantham McGregor at the University College London. This was a program in the 1980s. And this was the first randomized controlled trial and early childhood intervention targeting stunted growth in children in a low and middle income country that's now been followed up into midlife. So this is a home visiting program, and it's innovative in that it went beyond just nutrition to study the effects of adding psychosocial stimulation and behavioral skills. The home visitors worked with mothers whose children were between 9 and 24 months old. It was a 2-year program, and we followed them up now through age 31. So study participants experienced a range of long-term cognitive benefits as a result of the intervention. So at age 31, we see that the treatment group had significantly greater IQ gains and cognitive flexibility. The control group, they also had demonstrated reduced depressive symptoms, lower instances of substance abuse, and reduced risk-taking related to their health and work. So these cognitive, social, and emotional benefits likely had a positive impact on the education and earnings throughout the life cycle. So again, what this program is doing by working with the mother to work with the child, then you're building all of these skills. So a nutrition-based program can also include a parenting program, utilizing local health care workers. And again, so you're tying it all together with the infrastructure that's already there. You're focusing on the family, focusing on the child, but really you're having these long-term effects throughout the life cycle. And another thing that another group looked at the income later in life at age 31. So again, disadvantaged, physically stunted children, and they went on at age 31 to have more likely to graduate high school, so 26 percentage points higher for those that participated in the program versus those that didn't. And they also had 43% higher wages and 37% higher earnings overall than the control group. So this research strengthens findings from previous research that early interventions are effective for disadvantaged children in developing countries. And this low-cost, high-impact intervention has proven highly adaptable across a host of cultural contexts. So we're soon going to be working with collaborators who are replicating what's now called Reach Up and Learn all across the globe. And what we do is hope to collect, look at the data as a whole and understand the mechanisms by which these programs have lasting long-term effects. So we know cultures are different, workforces are different, parenting values might be different, but what can we learn globally about how human development and child development operates? So now just to switch gears, I'll tell you about a few, 2 programs in the United States. And again, there are many wonderful programs around the world, but there's an intuition here that's applicable to the work that you're doing and that lays the evidence base for you to understand how you are really developing the lives of children in adverse circumstances. So the Abecedarian program was in the 1970s. This was a full-day early childhood program based at a center at University of North Carolina. And what it did was it looked to expand the language of young children and interactions with adults. So it was kind of like a childcare program. This was the first one, early on, one of the first of its kind. But again, it was by researchers saying, what do we know about language and how can that help at-risk children? This program also included meals and health. So we know there are many other programs around the globe that do this as well. And so more recent research, now that we've followed them up at age 40, we see a 13% return on investment. So this program indeed paid off. And the returns from this come all the way across the life cycle. This is 13% per year, and it comes from different areas. So it's has 2 generations of effects. So mothers their children were able to attend this high quality full day childcare program. And as such, they returned to work or to schooling. So immediately their income base was greater, which meant that they then had more resources for the family and the home. And then also the child then was building their skills at the same time. So they also later had more advanced careers and income. And then I'll tell you also more about health. So the program paid for itself within 5 years. And even that's just based on the mother's income. Of course, this is in the United States, but in each own country, this story can be used to tell the importance of investing. So at age 35, we see definite effects on health in very important areas. So as we know, health and chronic disease is very costly. So by getting people to work, parents, and then children when they're adults, and by reducing health costs, as well as associated costs, just keeping people out of the workforce, these have direct returns. So it's a virtuous circle, right? Like I said, a 2-generation program. So by helping caregivers and parents in the short term with their child, either through childcare, which that's what policy priorities in some countries are. But even if a child might be having health issues, mental health issues, behavioral issues, anything that's supporting the child early on by effect is supporting the caregivers and the parents. And therefore, there's a business case to any programs working with children. You're promoting healthier lifestyles, preventing chronic disease, reducing obesity, lowering the risk of things like cardiovascular and metabolic diseases. So comprehensive programs can increase economic productivity while decreasing the prevalence of chronic disease and health term spending. There's one other program that we can look to. So the Peri-Preschool program was a preschool program. So it was part day, part year in Ypsilanti, Michigan in the 1960s. Also randomized controlled trial with long-term follow-up. These children have been followed up throughout their lives, most recently at age 50. And what we see is you're building the skill base. So this creates a stronger family life in a number of ways. So I'll let you know about that. So this program, if you've ever heard that there's a 7-to-1 return for investing in early childhood, those figures come from the Peri-Preschool program. So the children, one of the biggest innovations over the past 2 years out of our center is the work that talks about that has found the effects, intergenerational effects on the children of the original participants. So because they built their skill base, then when they had children, they provided stronger households for their families. So they were more educated, healthy, more gainfully employed, and therefore this carried over to their children. So this is not to say that we shouldn't be working on things like neighborhoods. Again, we're building the skills in children that allow them and their families to reduce the prevalence of neglect. And so there's still a lot of open questions. I was really happy to hear the last speakers talk about a call for research, but the evidence is clear. Early childhood is important, and so is the work that you do. You can contribute by ensuring an evidence-based policy and partnering with researchers. We know there's great effects. The best way to protect kids is to grow their skills so they become their best selves and overcome adversity. Empowering parents to grow their skills so they can be their best selves and provide the best parenting. Also, the clinicians, practitioners themselves absolutely need to have supports to address their resources, their own mental health, and to support the full infrastructure. So what we would like to do is ensure that we arm advocates with the best evidence-based policies, and so policymakers can pass and philanthropists can invest in programs which support skill development. And we would like to partner to help researchers. It's important to study these programs, to look for long-term impact, rather than just short-term outcomes and think whether a program worked or didn't. A lot of programs are criticized for not having short-term effects, or might be scaled up, just showing small-term effects. But when you look comprehensively, look to the parent, look to health, look to returns in areas that you might not be looking to tell the story, to build the investments. And also add it's a two-way conversation with researchers. So hopefully you can be helping interpret the data, how it's used, giving stories of how maybe it's misapplied, and what your experience tells about the research. So with that, you can visit our center. I would love to hear from people, from organizations, from individuals. And then also we have heckmanequation.org that has a lot of advocacy materials that can be used in your work. So with that, I think we still have a little time for questions.
Thank you so much, Allison. It's the hardest part, I think, of the work for people at the program level, to try to understand and capture metrics that show impact, and especially around the economic case that we're trying to build sometimes to attract governments and funders to invest in these public health programs. So it was a really, really good way for us to end our summit today. So thank you for being with us. We do have time for a couple of questions. If anybody wants to pose anything in the chat at this time. I guess while I'm waiting to see of questions coming up, can you talk a little bit more about how researchers and organizations like ours might engage with you in for help, or for, how do you work? How does the center work? And is there a way for us to get consultation or advice on how to do the right metrics to help us make our case?
Yeah, so I would point people first to the heckmanequation.org website to look at how the evidence is laid out there. There's a lot of PowerPoint decks and one-pagers just to start conversations, in your communities. And for us, I mean, we love hearing stories. The group, it's an interdisciplinary group at our center, but they are economists, and so data are very important. And that's really, it's hard to get, you need to respect the families and communities that you're working with. And so there's a lot of restrictions with data matching. And so we have, there are certain countries where that's a lot more just built into the infrastructure, what's collected, and that research is just part of the culture and part of the understanding. And in other countries, there's a lot of I think, well, just either lack of infrastructure or even lack of mistrust, for good reasons. And so, yeah. There are different ways to partner. We have groups all over, but ideally we would be looking for programs that have potentially were randomized or had some kind of variation when they were rolled out, and that have one of the most important things is it's not just about the effects of the program, it's about the control group. So what are the alternatives available? So for example, we talk about the Head Start impact study in the United States. So people will say, look, this large scale targeted to the public program is not effective because cognitive scores, fade out at 3rd grade. Well, okay, but people in the control group also might have gone to Head Start centers. So you're not actually comparing the effect of the program per se. So you need to understand people who didn't randomize into that program, or that had alternatives available.
Right. We do have a question that's come in from Mari, and she's saying that she's drawing attention to a research program called Childonomics that models, excuse me, the entire lifespan investment advantages.
Okay.
I didn't think it's done by Eurochild.
Okay.
But she's asking, is there any ongoing project on the measurement of interventions that you know of?
There are many. I wouldn't, there are none that I could off the top of my head recommend and say and point to. I know there are some groups that are trying to think about, draw from evidence base and say, what's the return to say this program or this program targeted at which age? A lot of those are just based off literature reviews or correlations. So I think we have a lot of concerns about that. They're definitely useful, but it depends on what is their use case. So if you really want to scale up a program, I think you need a more careful assessment. Again, looking at a more rich picture versus just comparing one program versus another, one age versus another.
Okay. And if you have any other guidance documents or resources that you want to share with our audience, I think we could also post those on our website after this summit. So we have another question from Nora, who's asking about, what about home visiting programs? Are the best investments that you've seen only in center-based programs? And what has the data shown you, and do you have any comments on that?
Sure. Yeah. So Jamaica was a home visiting program. So to date, a lot of people in the U.S. have just been talking about Abecedary and Perry Preschool, which were center-based. But yeah, we know that the 0 to 3 space matters. So I think people outside child development circles are getting it, and they know they need to look earlier. And home visiting is really important because what you're doing is then targeting the family, targeting the home. So from an economic perspective, they are lower cost, they are more scalable. Still more evidence to be built on that, but that's what preliminary we see. And yeah, targeting the family is important. What some of the things that we've heard is that since COVID and the turn to virtual, there's a lot more options in terms of reaching families. And so some programs, for example, we're working with a group in Ireland, Preparing for Life. They're really wonderful intervention. Some of what they did, they started with center-based just to recruit in families and to build a relationship, because that is a really difficult part of home visiting research, is getting into homes and building relationships with families. So the most hardest to reach children, yeah, you need to be able to find them and to work with them where they're at. So visiting can definitely be effective, and we need to continue to build that evidence base.
Right. I mean, many public health programs in the United States, Head Start programs, actually, those people, they deal with so many issues when they do those home visits. A lot of times they're sandwiched with other programs that affect these same high-risk populations, and so that they're trying to build that relationship, as you said, with families and have a more holistic approach to addressing many of their challenges. So
yeah, and also what we know is that the financing of these programs is very different. So in the 0 to 3 space, it is more likely to come from the public health sector. But then how are you addressing that 2-gen, the workforce development of the parent? So you do need the comprehensive approach, but it's very difficult when the funding streams, licensing, everything. So a lot of organizations that we're trying to work with and thinking about how to design a research study to really understand the mechanisms, what's going on in home visiting, particularly around parent-child interaction. That's what you're building, but how is that being done? And then what's the interaction between the home visitor and the child? Or sorry, the home visitor and the parent, right? There's a lot of things going on. But home visitors have a different approach, whether they're nurses or social workers, infant mental health specialists. So yeah, there's a lot of innovation there, which is really exciting.
Right, it is. It's a very complicated issue. I just want to see. There's a comment from Mari just saying that in Hungary, where she has universal home visiting programs, it has never been evaluated. But there are 4,000 health visitors, college trained and special training. It's very challenging for them. And I think that's pretty typical of a lot of countries where resources and, as you said, funding streams are very directed to address a certain thing, but not that thing. Only this thing. So I think we still have a long way to go with raising and really trying to build the case around why early childhood development is really important and worth investing in early on, especially for public health funding and governments to bring up.
So that's actually a fair number of countries do have the universal home visiting in terms of a well baby visit or a nurse coming to the home. And in the United States, we do not have that. We're just starting to maybe get one visit for some people, some places. But how do you extend beyond that? But that is what we're looking at, and kind of what Jamaica shows and these other Preparing for Life in Ireland, that it's not just providing the health visit. You have to add on to it the parenting components and parent supports. And then I always speak for, let's also support the workforce. They also have higher levels of poverty, a lot of stress, so many regulations put on them. It just
Wow.
compounds, I feel.
Right. Well, I really want to thank you for being with us today, and for sharing this insightful